Hi everyone, I am Dr. Pavitra Shankar and welcome back to the channel. I was sleeping yesterday and I thought of someone about whom I really thought I should make a video and I should talk about on this channel. And it gave me an idea to start discussing some of the people that I've met along the way in psychiatry and kind of start this discussion on how mental illness can shape a life, mold a life, change a life. So, story time. I was in the first year of my post graduation training, my PG training, just in the second month of training, where we had just stopped shadowing our seniors and we had just stopped our shadowing duties and had started seeing independent patients, etc. She came in the middle of the night on one of my friend's duties, and the next day I was told to take up the case. I did not know uh, who she was, what was going on with her, but I was just assigned it and I went to meet her. When I saw her, honestly, the young, naive first year in me did not want to take up that case because I knew immediately that it was going to be difficult, it was going to be challenging emotionally and mentally, and also could be medically complicated as well, and that I had to do a lot of work with this one patient. Now, when I look back at it, I understand that everyone in residency can have reservations about seeing critical patients, about having responsibility, especially doing them for the first time on your own. Because in psychiatry, in most places, a resident is assigned a case for whom they are responsible, uh, although with discussion and under supervision, but for the entire treatment, the management of the patient. However, at that time, I did feel a sense of guilt as to why I had this immediate reaction of aversion towards someone who has come to me as another patient. So she had come with a sister. Rahisa was around 40 years of age, but she looked much older than her age. She looked around 55, and which is a finding I remember I have only once ever mentioned in any of my mental status examinations till now, that the patient appears to be older than her stated age. She'd come with a sister who was around 10 years elder to her, but who still looked much younger than Rahisa. Rahisa was very thin built. Her hair had definitely fallen, and you could almost see the outline of her bones. And she was very cachexic as well. She had marks on her arms, on her legs, which showed that she had been put in some sort of restraints, most probably had been chained. These marks were not just of an acute event, these were old marks which had some had healed, some had not, some with primary intention, some with not. uh, and you could see that something had been wrong for a long period of time. When I took the history, and till date, even though it was just my second year or second month of residency, it has to be downright one of the most hardest histories that I had to take. So Rahisa had been around 20 years of age when she started showing signs of irritability, anger outbursts, not having enough sleep, and she slowly progressed to show signs of speaking even though no one was around, talking to herself even when others could not see who she was talking to, sometimes being awake at night and hearing someone but others could not hear this person, being scared that someone was coming to get her or her family. On one of these occasions, she followed some sound that she could hear, the voice of someone, which led to her falling down from a flight of stairs, after which she sustained a non-significant head injury. She also started showing signs of distrust. She had difficulty and a very difficult time trusting family members about their intentions. And despite reassuring that there was nothing of the sort that she was feeling, she would not be able to shake off that feeling that something was going wrong. And her suspicions towards the family members and towards the neighbors grew. There were certain instances where, due to the voices that she was hearing, which were quite distressing, it would lead to some very dangerous behaviors, which would be self-harming, and suicidal behaviors, because she would be very distressed with the voices that she was hearing. They were derogatory, they were abusing her, they were calling her names. This went on for a good 4 to 5 years, and she was taken to every possible facility that the family could think could provide any sort of treatment. So she had been taken to many Molvis, she had been taken to many faith healers, many temples. A lot of rituals had been done. There were some that involved being beaten by the priests with the broom. Some involved some difficult things like walking barefoot on stones and whatnot. But there was definitely no relief. Her symptoms got worse. She was, after 5 years, taken to a facility in Ranchi, where one of our biggest institutes of psychiatry is present, that is CIP Ranchi. But unfortunately, the family could not take them further because there were no caregivers, and Rahisa did not have parents who could take care of her. So taking care of her, that responsibility lied on the shoulders of her sisters, who also had commitments to their homes where they had been married off to. So there was really no caregiver for her. This went on for the next 10 years, where there was a vicious cycle of many treatments having been started, then stopped, and Rahisa's and no regular follow-ups. Nothing could be done regularly because there was no caregiver, and the family was not able to understand exactly what it is that had happened to her. There was a lot of stigma around these issues, a lot of misinformation that this had been due to some black magic, some faith healing required to be done. But despite the best intentions at heart, the family was not able to provide the support that she needed. Sadly, for the 5 years before she had come to our facility, she had been chained to a pole at her house, where she would defecate, she would urinate. She would only be allowed to take a bath every once in a week, where she would she'd be smelling, because obviously because of the lack of hygiene. She stopped eating food from whatever was given to by the family members, owing to the illness and also owing to this treatment that she was getting. And the family members did not know how to do better and what to do, and how to not let this affect their lives, and how to take care of her. And chaining her and restraining her seemed to be the only possible options they had, they seemed to have at that time. When she came to us, finally, she was brought by a very brave sister of hers, who had, despite not having permission from the husband, from her in-laws, she came all the way to Delhi from Uttar Pradesh, traveled all night in a bus, took Rahisa with her, brought Rahisa with her in the middle of the night. And it infuriates me as well as saddens me to say that that night she was not admitted because she had a chronic schizophrenia. She has these delusions, hallucinations, and despite the fact that there was so much dysfunction, so much distress, so much of a life having been destroyed due to the illness, due to the not treatment of the illness, the emergency room doctor did not feel that this was an emergency or that she should have been brought into the hospital facility immediately, despite the fact that they had nowhere to go. Rahisa and her sister spent the entire night in the hospital premises, much like the previous night, which they had spent at the bus stop in buses. And the next morning, they came to us and she was admitted. And she was in our facility for the next, unfortunately, 1 week. We started her treatment. We knew it was chronic schizophrenia, something which was not treated. And it's a known fact that the more the duration of untreated psychosis is, the more difficult it is to treat. But we still started her on antipsychotics because of her very frail built. We could not increase these medications also very fast because there was a high risk of extrapyramidal symptoms. There was a high risk of a lot of other side effects happening to her. We did not want any NMS type picture happening, which is very common, especially in patients of her profile. And it was very difficult to treat her because she would not listen. She would not be verbose. She would only respond to eat to having been provided food. She would spit. She would not hold a conversation. She would not be interested in talking to anybody else other than the sister. I unfortunately could not make a rapport with her in the initial days and much later as well. And I only got to know about her symptoms and any if there was any improvement through ward observation or through talking to the sister. And we had only started to see one improvement in the sleep. But unfortunately, I got a call at night on a Sunday where when I was at home and I was not on duty. I was told that I was taken back to Uttar Pradesh and by her sister, and they left against medical advice. A lama was done because it was the festival of Eid, and the sister was called back to her in-laws house. And understandably, it's an important festival for the community, and she also had her obligations towards her family. But they left with medications for 2 weeks with them with the promise that they will return. I was there in in that hospital for the next 3 years and 1 month, but I haven't seen Rahisa since. I haven't seen her sister since, and though I would like to keep a positive note of things, that's usually what I do. But I know in this case that would be frugal, that would be futile, and that would be too naive of me to think that um, she got into a good treatment facility. I wish she did, but we never heard of her. We tried contacting her through the phone number that they had given around 6 months back. We tried doing that, but it did not go through, so we did not know how to contact. And you can also not treat someone forcibly because the family members do need to consent in these situations. 15 years of one's life, 15 years in which a typical lady should have a career, have a family, raise kids, have grandchildren, live a life, buy a house, buy clothes, own a car, own a bicycle, own a motorcycle for that matter, have a romantic life, have a social life, have a personal life. All of that gone poof because we don't know how to talk about mental illnesses. We don't know how to educate people on mental illnesses. We are still stuck on the supernatural model of medicine. And while we should be doing better, we are doing better, but we're not at the right pace. Let me know if you also want me to talk about more such cases in future. Thank you so much for watching, and see you next time.